Welcome to Healthy Talk with BCH, empowering your wellness one conversation at a time. I'm your host, Rachel Mann, and today we have a very special guest, Dena Systma, the director of the Family Birth Center here at Boone County Hospital. Dena, thank you so much for joining us today.
Thank you for having me.
So to kick things off, can you tell us a bit about your background and what led you to your current role as director of the Family Birth Center here at BCH?
Yes, so I've been with Boone County Hospital for a long time. I started my nursing career back in 1996. I did not think that I wanted to be an OB nurse. That was the last thing that I wanted to do. But after getting my first job, I realized what I was doing wasn't what I wanted to do either. I had the opportunity to come to Boone County Hospital, started as a staff nurse, worked my way into the clinical charge nurse. And then in 2011, I had the opportunity to become the director of the Family Birth Center, and I've been in that role since.
What inspired you to pursue a career in maternal and child health?
So once I got into OB, it was just an option for me to do that. I was hired by Barb Butler a long time ago. She gave me the opportunity to really learn about maternal child health, learn how to be a really good OB nurse, and she was just a wonderful mentor for me. So that helped me just getting through the door and really figuring out what it was all about and learning that I did truly love what I was doing.
As the director of the Family Birth Center, what does a typical day look like for you?
My days really vary. It depends what is going on in the unit. I'm a little bit different because I staff more than half of my hours, which means I'm involved in patient care more than half of my hours. And then the other 16 or so hours, I have office time. So I spend time doing fun things like scheduling and budgets and all the paperworky kind of things. I am fortunate to be able to really be involved and work side by side with my staff and care for patients. That's the part of my job that I truly do love. Management is good too, but sure. I really love taking care of patients.
And it sounds like you like the balance. Sometimes you think the director and they don't necessarily get to do the patient and hands-on stuff maybe, and they're more at the desk more of the time. So
absolutely. Yes.
That's good. Can you describe some of the key responsibilities and challenges that you face in your role?
I guess one of the key challenges is just making sure that we are providing the best and safest environment for our patients. Medicine and maternal care is changing all the time. So that makes just kind of a moving target all the time. So just making sure that we're on top of those standards of care that are out there, working with our staff to make sure that they're well educated and know their jobs really well. In a small hospital, it's just a little bit different. In a larger hospital, you have teams of people that are doing things. They're doing quality initiatives. A lot of large hospitals have a staff educator. Here, we don't have that. We're a small team, and I do a lot of those roles, but my team is also really involved too. We utilize the expertise of our team members too to educate our staff. I have an internationally board certified lactation consultant, Jamie Fox Clayton. She does a wonderful job educating our staff about breastfeeding. Casey Mahana is one of our other nurses. She's a certified car seat expert. She's gone through the National Traffic Safety Bureau education. So she educates our staff about the importance of car seats and car seat safety. So we do have a lot of experts within our team that we utilize too.
Could you provide an overview of what services you offer expectant mothers and their families?
There are so many things that we do in our small little unit. We are considered a level 1 low-risk obstetric service. So ideally, we are delivering patients that are 35 weeks gestation and above with limited obstetrical complications. Occasionally, we do get patients in that do have higher needs, or they're in a preterm labor and they're going to deliver before we have the opportunity to get them to a larger hospital. So our staff are trained in how to manage and care for those patients in the short term, but ideally we're taking care of those healthier, higher gestation patients. So that starts early in their pregnancy. So we generally see patients 20 weeks gestation and above. If they're having any kind of complications related to their pregnancy, they'll come to the Family Birth Center and we will take care of them. Some patients have to have antenatal testing, so we do non-stress tests with those patients. And that's kind of fun because we get to see those patients on a weekly basis, really get to know them before they come in for their delivery. Once they're through that portion of their pregnancy and it's time to have a baby, we have them come into the hospital, whether they're in spontaneous labor, if they're going to have an induction of some sort, or if there's a planned C-section involved. Okay. And then we work with them through their labor and delivery. We have lots of different services for labor that we offer. Pain control is one of the things that women talk a lot about. Yeah. So that's something that we like to know what the woman wants for herself. I feel like our whole team right now is really invested in providing a birth that is what that person wants.
Sure.
So we ideally would have a birth plan from the mom, but if not, we talk about that when they get here and what do they want out of their labor and how do they want it to look for them, because it's most important. That's their experience. It's not ours. Right. So it's really important that we provide them with the experience that they want in a safe manner. So pain control options, we have obviously natural labor is supported. We also offer nitrous oxide. A lot of people have heard of it as laughing gas.
Okay.
So that's another option that can help assist with some of the pain management, up to the point of regional anesthesia or an epidural, which generally takes away a lot of the pain, makes patients pretty comfortable. There's other options in there too, but that's kind of the spectrum from doing just labor support. And natural labor, the patient isn't just in a room by themselves trying to deal. Natural labor is there's a nurse at the bedside with them. We're helping them change positions. We're offering them different opportunities. We have birthing balls and peanut balls and massage. We have aromatherapy. They can get in the bathtub or the shower. Lots and lots of different labor support options if they choose a natural labor path. Realistically, a lot of women start with a natural labor path, and maybe they intend to do that for a while and know that they're going to get an epidural later in their labor, which is totally fine. So they get the whole spectrum of all of that support.
I know that's what I wanted to do, especially with your first. Kind of want to just know, what is it? What does it feel like? And then, okay, I think I'm hitting that point. We're ready for something a little
stronger.
Exactly. How does the Family Birth Center ensure a safe and supportive environment for both mothers and newborns?
Well, there are a few things. One of the most important things is we listen to our patients. We hear what they are wanting. We hear what they're telling us they're feeling and what is going on with their pregnancy. And women need to understand that we really value what they're saying and what they're telling us, because sometimes we don't recognize it until the mom lets us know that they're having a symptom or something's really going on. We are involved in maintaining really high quality care for our patients. We have a very well-educated staff. Our nurses do fetal monitoring education every year, as well as other education. We're involved in a statewide maternal quality care collaborative that we've been involved in for the last 3 years. The whole focus of that collaborative is to improve the outcomes of moms in the state of Iowa. Currently, every birthing hospital in Iowa is involved in that collaborative, though it is a voluntary thing. And so we've been excited to be involved in that collaborative from the start. That has looked at some really important emergency things that we worry about in OB. If you might bleed too much after delivery, or if your blood pressure gets too high, it's called severe hypertension. Also, we're concerned about having too many C-sections. So one of the initiatives was looking at primary C-sections, or that first-time C-section for moms. All of those have safety bundles, which is evidence-based recommendations for what we can do as care providers to ensure the safest environment possible. So we've implemented, and we had implemented quite a few of these measures, but we've implemented those measures fully now within our department so that we have those tools available for our staff.
We've kind of talked in every podcast about the rural aspect of Boone County Hospital, and I know our marketing department and everybody here has been doing a lot to promote just OB at Boone County Hospital, because you hear some people, I didn't even know they did that. And you're like, well, they're not as big as this hospital in Des Moines or this hospital somewhere else. I thought it was such a blessing. I mean, I don't think there was anybody else here when I had my babies. Maybe one came at the end, but just having basically like all these nurses focused on you, and especially when it's your first time, I feel like that's a big pro of having OB at a rural hospital.
Absolutely. There's always limitations to the rural area, but we do OB in the safest manner possible for a rural environment.
And we're not that far from a bigger hospital if something happens.
Exactly. It's a 20-minute flight for the NICU team to come. If we have a baby who is sick, they can be here very quickly. Again, life flight's an option for mom as well, if there would be some significant complications. That's a really rare occurrence that we utilize those services. But we do have them available and have agreements with other hospitals to be able to get our patients to a higher level of care if it's needed.
What kind of prenatal and postnatal care does the Family Birth Center provide?
Prenatal care, we have options for education as well as that antenatal testing we talked about. We do offer childbirth preparation classes. It's a 2-evening course that is offered about every other month Jamie Fox Clayton's our childbirth educator. She's also our breastfeeding educator. So part of that involves baby care and breastfeeding information for new parents. The other class that is offered is sibling class for older siblings. So anywhere from 2 to 10 can come and see the hospital where mom is going to be at, learn a little bit about what it's like to be an older sibling. They get to make a little onesie for their baby that's coming. Yeah. Get their picture taken. It's a fun class for those little ones to be involved in.
So supporting families through the childbirth process is incredibly important, especially for first-time parents. How does your team support them? You talked about that you have the childbirth classes and sibling classes, and you also have Jamie, a lactation consultant.
We do support them in labor. All of our OB nurses have been to Spinning Babies, which is a labor support course specific to positioning patients, assisting in different activities that patients can do while they're in labor to assist their labor to progress. So dependent upon where the baby's at in the pelvis or what's happening with the labor, we can do different techniques to help move that forward, help the baby engage in the pelvis, maybe make things a little bit more comfortable for mom, hopefully. So that's a really awesome opportunity that we've had because not very many hospitals can say they have had every single staff member to that course.
Awesome.
It's pretty cool. Also, out of our 9 full-time RNs, 6 of our 9 RNs are nationally certified in inpatient obstetrics and or fetal monitoring. So that's a huge accomplishment too. Those nurses have to work really hard to earn those certifications. And then once they do get those certifications, they have to maintain those every 3 years with education and things. So it's a big deal that we have more than half of our staff certified.
It sounds like your team plays a very crucial role in the Family Birth Center success.
The team is the most critical component to this whole thing. The staff in our department are compassionate, they're caring, they want to do the very best possible for each patient that they encounter. They really are the backbone to the care that we provide here in the obstetric service here at the hospital. We do have nurses that have their special areas and niches that they're interested in, and they help to educate the other nurses in those areas, and they support the patients specifically for that. But ensuring that all of them have the knowledge to provide the care that's needed is great. And they do that. They have the initiative to learn those things and to ensure that they can perform when an emergency occurs or a critical situation comes up. They are very, very committed to our quality program as well. We always have several quality initiatives going on in the Family Birth Center, and they are the ones that do all the work for that. I do the paperwork, but they do all the work to ensure that we're implementing the quality initiatives in our clinical setting. So one of the things that we've done in the last couple of years is more skin-to-skin time with our moms and babies, and really getting those babies with their mommies as soon as they're born and keeping them with them for the first couple of hours after birth. So the nurses really played a key role in trying to figure out ways that we could be more successful with that. One of the big changes for us was implementing skin to skin in the OR. So if a mom has a C-section, a lot of times they didn't get to see their baby for a little while, or they got a quick peek at their baby, like, here's your baby, and now here we go. And they didn't get to spend that time with their babies. Now those babies stay as long as they're well, and mom is well too. They get to stay right there with their mommy for that whole time in the OR. Some babies are breastfeeding while they're finishing surgery. So it's just a completely different environment than it was even just a few years ago.
Because we're a small hospital, the nurses that you have while you're laboring, delivering are the same nurses that you have after, right?
Absolutely. Yeah. If you have a nurse on a weekend stretch, you may have the same nurse the whole time that you're there for the day shift or the night shift. You might have that one familiar face that you get to see each day. It's pretty awesome how the relationship you get to build.
As a mom, I mean, if you're at some of the bigger hospitals, you might have one nurse do this, one nurse do this, and you're meeting all these new people. And just to have something constant in this crazy, exciting part of your life, I feel like just helps calm and kind of keep everything.
Yeah. You know who's coming in the next day to see you. You know that you're in good hands because they have taken care of you the day before.
Yeah. And our team here, you can't say enough good things about them.
I absolutely can't. I am very, very fortunate to be able to be the director of this team. They are a really wonderful group of ladies. They have great hearts. They have wonderful personalities. They
love what they do.
They love what they do.
So do you have any specific departments here at Boone County Hospital who have been particularly impactful?
I feel like the team of Boone County Hospital as a whole is imperative to the care that we provide in OB. So we work very closely with the surgical services department. They do simulation drills with us. We practice different emergencies with them. The anesthesia service is huge. We collaborate with them with our epidurals, or if we have to go down to the surgery department for a C-section. Sure. Lab is right in there with us, drawing our patients, taking care of blood products, things like that in different emergencies. And then radiology, not necessarily during the laboring process, but we have wonderful ultrasound techs in our radiology department that provide a really good service to our patients prenatally.
It's funny because we've had podcasts interviewing a lot of those departments that you just said, and they've talked about working together. I know like Amy Bachman, who talked about radiology, she talked about coming to like doing ultrasounds and stuff, and Genevieve talked about doing epidurals. It's fun to kind of have everybody on podcast hear how much other departments help other departments.
Absolutely. And it's wonderful here at Boone because we do have the opportunity to really know those people in those other departments. It's relationships. So it's fun to be able to work with each other.
So speaking of collaboration, we're very fortunate at Boone County Hospital to have family practice physicians who specialize in OB. We've done a podcast with Dr. Hay talking about family practice versus OB specific physicians. So you could listen to that if you want. We've also had a podcast with Jamie, the lactation consultant. She was our very first podcast ever. So how does the Family Birth Center work with those family practice physicians to provide comprehensive care for expectant mothers and their families?
Well, we are so fortunate to have wonderful family practice providers. Dr. Seveson, Dr. Hay, and Dr. Lincoln Meyer provide the obstetrical service to our patients here at the hospital. They are smart, they are kind, they hear their patients, they hear the nurses. We're able to collaborate with them, ask them any question, and they're willing to have a conversation and discuss with us. So we are very, very fortunate to have such wonderful people here caring for our patients and working with our nurses.
And we have
great.
Two new
providers coming this fall. Dr. Hernandez will be in Ogden and Dr. Holmes will be at the South Clinic. So that will be fun to get to know them and to learn their practices as well.
And even more options for people. You can go to them if you need OB stuff, but they can be your full-time doctor.
Yep, they're there for everything from beginning of life to end of life. So we have the opportunity for the patient to really see that one doctor all the way through. Or if they choose to, they can continue with one of our other family practice doctors with their baby's care too, if they've already established with them, so they can come over to one of our physicians that do OB for their delivery, but they can certainly return to their doctor that they'd had previously established with for the rest of their family's care too.
We have great options here.
Lots of options. They do listen to their patients and they do want to provide that birth experience that the patient wants. They spend a lot of time prenatally talking to their patients about what they want their delivery to look like, how we can accomplish that together as a team. They keep the OB staff informed as to what's going on. So we have a connected computer system like a lot of organizations. So if somebody does come in with an issue prenatally, we can just look up their prenatal, see what has been going on in the clinic, and have their history right at our fingertips. So it's nice to be able to have access like that. But in planning for an induction, we speak with those providers ahead of time, kind of find out what the plan is so we can educate the patient appropriately when they get here and put them at ease and let them know kind of what the plan is for the day and how things will progress. Our doctors have really earned a reputation for hearing their patients and trying to provide that birth experience that the patient wants.
You can talk to them and just feel their passion and how much they care about their patients. It completely comes through in Dr. Hayes' podcast. She's just so passionate about what she does.
They're genuine. They're so genuine and they're so kind. They're just awesome people.
How do you ensure seamless communication and teamwork between the Family Birth Center staff and our family practice physicians?
One of the tools that we've implemented in the last couple of years is called Team Birth. So in each of our rooms, we have a huddle board, has some basic information on it for the patient so they can see who their care team is, where their cervix is dilated to in labor, when the next assessment is planned to be. But part of that is the huddle that occurs, and it's the opportunity for the patient and their family member to be part of the team and have a say in what happens. And so at the beginning of each shift, the nurse, the physician, the patient, and whomever they want to be involved in their care huddle together. If anesthesia is there and needs to be involved, they can come in too. But what it does is it just sets a plan for what's happening and allows everybody to have a voice and ensure that doctor, the nurse, the patient, everybody is on the same page. Okay. We can also call a huddle at any time in the future. And I always educate my patients. If you ever feel like you're not being heard or you don't understand something that's going on, please ask.
Yeah.
And if you still don't feel like that's happening, we can certainly do a huddle. And that brings the whole team back together. We can reset our plan. We can figure out what's going on. And we can make sure that we're doing what's in the best interest of you and your delivery.
Yeah. How does the Family Birth Center stay up to date with the latest best practices in maternal and child health care?
We utilize our resources. We are not a trendsetter. We're a small hospital, so we're going to do what the standards indicate for us to do. We want to provide that safe care for our patients. So there are a few nurses that are involved in our professional organization, A1, Association of Women's Health Obstetrics and Neonatal Nurses. They set out practice standards that help to guide some of our care. American College of Obstetrics and Gynecology is another professional organization that we have a membership to so that we can see their standards and recommendations as well. Another opportunity that we have as a hospital is that there is a statewide perinatal review team that comes. It's a team of practitioners from the University of Iowa. It involves a maternal fetal medicine doctor, a labor and delivery nurse, a neonatologist, and a neonatal intensive care unit nurse. They come about every 18 months and they do an audit of some of our highest risk charts. So those patients who had complications that were not anticipated possibly, and they look through all of those. They give all of the nurses and physicians feedback. And that's what's really cool about this team. They come, they do these audits, they look at the care that we've provided, and then they meet with the nurses and the physicians together and they give their feedback to us. And so the nurses, the physicians, everybody is hearing the same thing. They were just here in February and they gave us some really awesome reviews, really reassured us that we are providing excellent care here at the hospital and doing the best that we can for our patients.
That's awesome. How does the Family Birth Center engage with the community to promote maternal and child health?
We have really been trying to work hard to get more involved in the community in the last couple of years. One of the things that we've done is the library fair in June. We've had a table there with an activity. Last year we did a duck pond game. This year we did some tattoos with the kids. It's been a lot of fun. Another thing that we're going to offer this fall in October 17th, we're going to have a ladies' night. And so offer women in the community the opportunity to come into the hospital, see the services that we provide for women's health care, not just obstetrical services. But part of that is going to be seeing our OB service, touring our unit. We'll have our lactation consultant available for conversations. We'll have prizes. It'll be fun.
Snacks.
Yep, snacks, prizes. It'll be a fun night. There'll be more to come on that.
Yes. Are there any outreach programs or partnerships that you're involved with that you'd like to highlight?
A really awesome partnership that started in the last couple of years is our partnership with Van Diest Medical Center. A lot of people aren't aware, but many small hospitals in the state have closed their obstetrical service. So we are very fortunate in Boone to still continue to have an obstetrical service and provide that to our community. Van Diest lost theirs a few years ago, and so our providers have worked with their providers to do what's called a shared care OB model. So the patients from Webster City can see their practitioners in Webster City until they're like 28, 32 weeks gestation. And then they come over to Boone and they see our OB doctors. They come to our hospital and deliver with us. So that's been a really wonderful partnership that's continued to grow over the last couple of years.
Can you highlight some of the major achievements of the Family Birth Center in recent years? I know this year specifically we had a high exciting number of deliveries.
Yes, that has been very exciting. For fiscal year 24, which ended on June 30th, we had 113 births this year.
So awesome.
That's about a 30% increase from the year before, which is wonderful. And we anticipate to finish at about 120 for our calendar year, which is also a growth when you look at that number as well. So it's pretty exciting for us. Another thing is we got the birthing friendly hospital designation from CMS this last fall. And that is due to our involvement with the quality care collaboratives and really taking an initiative to implement those safety bundles that we talked about earlier.
Shifting gears a bit, can you share a memorable experience or story from your time working in the Family Birth Center?
I've been doing this for a really long time. So 28 years. It's kind of crazy. There's lots of memories, lots of different things that I've experienced with families and patients. Some of them really stick out in my mind. You know, those happy tears, those sad tears, really building relationships with families, those families that have come in and had all three of their babies here. And maybe I've had the opportunity to be their labor nurse for all of their babies. There's one family I remember that I was labor nurse for all the girls. The grandma was there with each one of the births, and I got to be there to see all of her grandbabies born. So that was a pretty cool opportunity too. Small town is nice. You really get to know the people here, and you remember them and they remember you. It's kind of crazy to walk into Hy-Vee or Walmart and people are like, oh, hey, hi, how are you? And you get to see their children after they've grown. It's pretty fun.
What do you find most rewarding about your work with new and expectant mothers?
I think the most rewarding thing is the relationships that I've built, and then seeing those families go out and know that when they leave, they're going to succeed. Knowing that they've been provided with the care and the education that they need to take care of their new baby, that they're comfortable in themselves, supporting them, even if they aren't 100% ready to go when they leave the family birth center, knowing that we have that resource for them to come back. They can come back for lactation support at any point in time, and knowing that we have providers too, that if they do have complications or questions, they're going to be there to answer their questions anytime they need it.
I know when I had my second, I remember calling and I feel like by the second time I should know stuff, but there was just some things that were very different second time around. It's just nice to be able to know that you can call whenever and have that reassurance that it's fine or we need to see you.
Absolutely.
Looking ahead, what are some of your goals for the future of the Family Birth Center?
One of our biggest goals is just to continue to see that growth. Adding additional providers means we should be adding additional patients. Getting that word out that our providers do provide that wonderful care for our patients.
We've talked about this service that some people didn't even know we've had, and it's been here for
100 years.
125
years.
We want to tell what great service you can get at Boone County Hospital, that we care about you, that we want to have more families come. And like you said, with the increase of more providers coming this fall, they are family practice providers, but they have that specialized OB. We could have gotten providers that didn't do that, but that's what we care about. We want to be able to care for your entire family on every spectrum.
Yes, and that absolutely shows the commitment of our administrative team and our board to this obstetric service. They have 100% been behind the OB service throughout the years. They want us to succeed, and they really kind of put their money where their mouth is when it comes to OB. They're willing to invest the time and the efforts to really make it a successful department within the organization.
Yeah. And I think the hospital is something that you don't necessarily think about until you need it. And when you need it for a big moment in life, having a baby, and you have that great experience there, it makes you want to utilize other services too.
Absolutely. Often the delivery of a baby is a person's first opportunity to actually experience a hospitalization and everything that goes with it. It can be really scary. It can be overwhelming. Just bringing new life into the world is a little bit overwhelming. So just to have the support and the people there that are going to provide the care that you would expect and that you need, and it's right here in your community.
Yeah. What advice would you give to expectant mothers and families preparing for childbirth?
I would really encourage people to become educated, learn about what the birth experience involves, take care of yourself, know what your options are, and be ready to discuss those things with your provider. Don't be afraid to tell them what you're thinking, speaking out about what's scaring you. I always say there's never a dumb question. If it's going to make you worry, then you just need to ask it and get the answer, knowing that you can have that birth experience that is meaningful to you and achieves the goals that you set. But being aware of what those goals might be before you get here is also really helpful. There's a lot less fear if you come in with a little bit of knowledge than come in blind and really not knowing at all what to expect.
What guidance would you offer for people interested maybe in a career in maternal and child health?
I would say come in being ready to learn. There's so many things to learn. The advantage here at Boone County Hospital is that we get to do, it's almost like doing 3 different departments.
Sure.
So in a larger hospital, you're going to have a labor and delivery nurse, and then you'll move and you would have the opportunity to be a mother-baby nurse where you take care of postpartum and newborns. And then they have the neonatal intensive care unit nurses that take care of the sick babies. So there's different areas that you'd work in. At Boone, we get the opportunity to do all of those things. We get to care for the patient all the way through their labor, delivery, recovery, postpartum. So knowing that you need to be ready to learn and to learn a lot of things. And with healthcare, in all of the years that I've been doing it, you never, ever stop learning. It's just constant. There's always changes. There's always new things. That's just the nature of healthcare. If you want to be a really good nurse, you have to be willing to continue to learn and improve yourself. And you have to have some initiative to do that with the support of your organization, but also on your own. It's a very, very rewarding job. I don't think there's anything else out there like it.
Thank you so much, Dena, for sharing your insights and experiences with us. It's been great talking to you today. And thank you to our listeners for tuning into this episode of Healthy Talk. If you have any questions or want to learn more about the Family Birth Center at Boone County Hospital, visit our website, www.boonehospital.com. You can find information. You can sign up for our childbirthing classes or our sibling classes. Make sure you also get Ladies' Night on your calendar for October 17th. It'll be here at the hospital. Listen to any of our old podcast episodes. We have one with our lactation consultant, Jamie Clayton. And we have one about family practice versus OB with one of our family practice OB doctors, Dr. Hay. And if you need a family practice physician for your OB, be sure to call our clinics and get in with any of our 3 family practice OB doctors, Dr. Hay, Dr. Linkenmeyer, Dr. Stevenson, and then our 2 new OB family practice doctors coming this fall, Dr. Hernandez in Ogden, and Dr. Holmes will be at the South Clinic. Be sure you stay tuned and subscribe for more engaging episodes on Healthy Talk. And until next time, stay informed, stay healthy, and keep the conversation going with Healthy Talk.